She came in on a Tuesday morning. 71 years old, retired school librarian, grandmother of 4, the kind of woman who brought homemade cookies to every appointment and remembered the names of every nurse on the floor. Her name was Dorothy, and she had just been diagnosed with stage 3 colorectal cancer. What stopped me in that moment was not the diagnosis itself. It was what she said when I sat down across from her. She looked at me and said, "Dr. Pablo, I felt completely fine. How does something like this happen without a single warning?" And I had to look her in the eye and tell her the truth. It happened quietly, over years, in a way that produced no pain, no swelling, no alarm bells of any kind. It happened because of something most doctors spend less than 4 minutes discussing in a typical office visit, and yet the research connecting it to cancer after the age of 60 is among the most robust and replicated bodies of evidence in all of modern medicine. I am Dr. Pablo. I am a board-certified geriatrician with 18 years of clinical experience working with adults over 60, with a particular focus on cardiovascular and metabolic health. And what I am going to share with you today is the conversation I wish every one of my patients had heard 10 years before they ever sat down in my office. Stay with me through every minute of this video, because what I am building toward, the number one most dangerous piece of this puzzle, is something I see missed completely in clinical practice every single week. And by the time we get there, I want you to fully understand why it matters as much as it does. Let me begin with something that I need you to genuinely understand before we go any further, because without this foundation, nothing else I tell you today will land with the weight it deserves. Inside your body, right now, there is a biological process unfolding that you cannot see, cannot feel, and have almost certainly never been told to monitor. It has no dramatic symptoms. It does not announce itself. It simply persists, year after year, quietly reshaping the internal environment of your body in ways that make disease not just possible, but increasingly probable. We call it chronic low-grade inflammation, and if you are over 60, you need to understand that your body is biologically predisposed to it in a way it was not at 40, and certainly not at 30. Scientists have a specific term for this age-related inflammatory shift. They call it inflammaging, a word constructed from inflammation and aging, and it describes a process that is now one of the most intensively studied areas in geriatric medicine. As we age, the immune system undergoes a fundamental change in its baseline behavior. It begins producing higher levels of inflammatory signaling molecules called cytokines, including interleukin-6 and tumor necrosis factor alpha. At the same time, it becomes less capable of resolving inflammation once it has started. The result is a state of persistent, smoldering immune activation that runs below the threshold of anything you would notice in daily life, but operates continuously at the cellular level. And here's the part that should make every person watching this stop and take a breath. A landmark analysis published in Nature Reviews Cancer identified chronic inflammation as a contributing factor in approximately 1 in 4 cancers worldwide. Not a fringe estimate, 1 in 4. A separate long-term study tracking more than 100,000 adults found that those with elevated blood levels of a marker called C-reactive protein, which is a standard measurable indicator of systemic inflammation, had significantly higher rates of colorectal, lung, and breast cancer over a 15-year follow-up period. The biology of why this happens is not mysterious. Your cells are dividing constantly, trillions of times throughout your lifetime. Under normal circumstances, your DNA replication process is extraordinarily accurate. But when chronic inflammation is present, it floods the cellular environment with chemically reactive molecules called free radicals, and those molecules can damage DNA during replication. When that damage accumulates faster than your repair systems can address it, mutations develop. And mutations, compounded over time, are how cancer begins. That is the mechanism. That is the pathway. And understanding it is what makes everything I am about to tell you not a list of general wellness advice, but a specific, targeted, evidence-based strategy for intervening in that exact pathway before it reaches a point of no return. I want to walk you through 5 areas of daily life that are either feeding that inflammatory fire or extinguishing it. And I want to give you the research, the clinical reality, and the actionable specifics for each one. I am going to save the most critical one for last, because it is the one that most directly predicts your inflammatory trajectory over the next decade. And most people are getting it catastrophically wrong. Let us start with number 5. What you eat is not just fuel. It is a continuous molecular signal to your immune system. Every meal you consume either reinforces an anti-inflammatory environment inside your body or contributes to the chronic low-grade activation I have been describing. This is not a metaphor. This is biochemistry. The EPIC study, the European Prospective Investigation into Cancer and Nutrition, followed more than 500,000 individuals across 10 countries over more than a decade, and found that people whose diets were built around vegetables, legumes, whole grains, olive oil, fatty fish, and nuts had dramatically lower rates of several cancers than those eating a Western dietary pattern high in processed foods, refined carbohydrates, and red meat. In some cancer categories, the risk difference was 30 to 40%. Think about what that number means. Not a marginal improvement. 30 to 40%. And the reason is not vague. Extra virgin olive oil contains a compound called oleocanthal that inhibits the same inflammatory enzymes that ibuprofen targets, except you are consuming it as food, daily, as part of a pattern of eating, rather than as a pharmaceutical. Omega-3 fatty acids found in salmon, sardines, and mackerel have been shown in multiple controlled studies to reduce circulating levels of interleukin-6 and tumor necrosis factor alpha, the very cytokines that drive the inflammaging process. Berries contain polyphenols, including anthocyanins, and compounds related to resveratrol that have been studied specifically for their ability to interfere with cancer development at multiple stages. Leafy greens provide folate and antioxidants that help protect the integrity of DNA during cell division. I had a patient, Frank, 67 years old, retired electrician, who came to me with an elevated C-reactive protein level of 4.2 milligrams per liter. That is a level that places someone in a high-risk category for cardiovascular disease and is increasingly linked to cancer risk as well. Over the course of 4 months, Frank made a committed shift toward a Mediterranean-style dietary pattern. No supplements. No prescription changes. Food. When he came back in for follow-up labs, his C-reactive protein had dropped to 1.8. That is a measurable, objective reduction in systemic inflammation achieved through diet alone. His words to me at that appointment were, "I did not realize I had been running a fire inside my body for years." That is exactly what chronic inflammation is. A fire you cannot see. Number 4 brings us to movement. And I want to be very specific here because there is a pervasive misunderstanding about what the research actually shows and what the threshold for benefit actually is. The American Cancer Society, in its most recent clinical guidelines, listed physical inactivity as one of the most significant modifiable cancer risk factors available to address, second only to smoking and obesity. A large meta-analysis, published in the British Journal of Sports Medicine, found that adults who met standard physical activity recommendations had a 20 to 30% lower risk of developing colon cancer, a 20 to 30% lower risk of breast cancer, and meaningfully reduced risk of lung and endometrial cancers compared to sedentary individuals. 20 to 30% with walking. Not chemotherapy, not targeted therapy. Walking. The mechanism goes well beyond caloric expenditure. When you engage in moderate aerobic activity, your skeletal muscles release proteins called myokines, and these myokines have direct and measurable anti-inflammatory effects throughout the body. Exercise also reduces circulating insulin levels and insulin-like growth factor, both of which, when chronically elevated, create a hormonal environment that actively promotes cancer cell proliferation. 30 to 45 minutes of brisk walking, swimming, or cycling done consistently is not a wellness recommendation. It is a molecular intervention in the exact biological processes that drive cancer risk after 60. My patient Gerald, 73 years old, a retired mail carrier who had spent decades on his feet but had become largely sedentary after retirement, told me he felt it was too late to make a difference. I showed him the data. We started him on a structured walking program, 30 minutes 5 days a week, building gradually. At his 6-month follow-up, his inflammatory markers had shifted, his fasting insulin had dropped, and he told me he had slept better in those 6 months than he had in the previous 3 years. Which brings me to something I want you to hold in your mind as we get to the most critical factor, because sleep and movement are more connected than most people realize. Before we get to numbers 3, 2, and 1, I want to pause for just a moment, because the people watching this video are exactly the people this kind of research was built for. If you are 60 or older, you are in the age window where these interventions carry the most meaningful impact, because the inflammaging process is accelerating, and the window for early preventive action is real, and it is now. I want to hear from you. Write your age and where in the world you are watching from in the comments below. I read every single comment, and knowing who is watching helps me understand what topics matter most to the people I am making these videos for. The community in this comment section is full of people making real changes, and I want to know you are part of it. Number 3 is where we start to enter territory that most mainstream health discussions skip almost entirely, and that is the profound relationship between chronic psychological stress and inflammatory biology. This is not about telling you to relax. This is about a specific hormonal and immunological cascade that, when left unmanaged over years, measurably accelerates inflammaging and compromises the very immune surveillance system responsible for identifying and eliminating precancerous cells before they establish themselves. When you experience stress, your adrenal glands release cortisol. In short bursts, cortisol is actually anti-inflammatory. That is by design. It is part of the acute stress response. But when cortisol is chronically elevated over months and years, the immune system develops a phenomenon called glucocorticoid resistance. It essentially stops responding to cortisol's regulatory signals, and the result is a paradoxical state of immune dysregulation in which inflammatory cytokine production goes unchecked. A study published in the Proceedings of the National Academy of Sciences found that individuals with high levels of chronic psychological stress showed gene expression patterns in their immune cells that were consistent with a significantly more pro-inflammatory state. Research published in JAMA Internal Medicine found associations between chronic stress, impaired natural killer cell function, and increased cancer risk, particularly for hormone-related cancers. Your natural killer cells are your internal surveillance team. They patrol your bloodstream and tissues, identify abnormal or precancerous cells, and destroy them before they can establish a foothold. When chronic stress suppresses that surveillance capacity, the window for cancer initiation widens. I had a patient, Margaret, 64 years old, a retired nurse who had spent decades in high-acuity hospital settings and had carried that hypervigilant stress response into her retirement. She came to me with persistent fatigue, elevated inflammatory markers, and what she described as a body that felt older than her age. We talked not about meditation in a vague wellness sense, but about the specific physiology of what chronic cortisol elevation was doing to her immune function. She committed to a structured daily practice that included 20 minutes of low-intensity movement in the morning and a disciplined wind-down routine in the evening. Over 6 months, her inflammatory markers shifted in the right direction, and she told me, for the first time in 30 years, she felt like her body was working with her rather than against her. Managing chronic stress is not a soft recommendation. In cancer prevention terms, it is a direct intervention in immune surveillance capacity. Number 2, and this is where I see some of the most significant clinical gaps in my patients over 60, is sleep. Not the idea of sleep in a general sense, but the specific biological work that happens during sleep that cannot happen at any other time, and the devastating downstream consequences when that work is consistently interrupted or abbreviated. During deep sleep, your body activates its primary DNA repair enzyme systems. The accumulated genetic damage from a day's worth of oxidative stress and cellular division is assessed and corrected during those hours. Your immune system consolidates its memory, reinforces its surveillance capacity, and produces key anti-inflammatory compounds. And perhaps most critically, your brain activates a clearance system called the glymphatic system that flushes metabolic waste products, including inflammatory debris from neural tissue, in a process that is almost entirely suppressed during waking hours. When you consistently sleep fewer than 6 hours per night, none of this repair work is being completed. A study published in the Journal of the National Cancer Institute found associations between shortened sleep duration and elevated cancer risk, specifically for colorectal and breast cancer. Research from the University of California found that a single night of sleep deprivation reduced natural killer cell activity by over 70%. 70%. And when that deprivation is chronic, when it persists week after week, month after month, the cumulative suppression of immune surveillance function is substantial. For adults over 60, sleep architecture changes. You spend less time in the deepest and most restorative stages of sleep. That is a normal physiological shift, but it means that what sleep you do get needs to be protected with a seriousness that most people simply do not apply to it. My patient Carol, 70 years old, a retired bookkeeper and grandmother of 5, came to me convinced that her 5-hour nightly sleep pattern was simply who she was. She had read that older adults need less sleep and had accepted broken, abbreviated nights as a fact of aging. I explained to her that while sleep architecture does change with age, the biological need for sufficient restorative sleep does not diminish. We walked through her sleep environment, her evening habits, her screen exposure, her caffeine timing, and made a series of specific and deliberate adjustments. Within 8 weeks, she was averaging 6.5 to 7 hours, with notably fewer nighttime awakenings. Her energy shifted, her mood shifted, and at her next inflammatory marker panel, her results had moved meaningfully in the right direction. Sleep is not passive recovery. It is the most active cellular maintenance period in your entire 24-hour cycle, and for cancer prevention after 60, it is non-negotiable. And now we arrive at number 1. The single factor that I believe is the most underappreciated, most consistently underaddressed, and in terms of long-term inflammatory consequence for adults over 60, the most dangerous when neglected. I have been building toward this deliberately because I want you to understand it in context. Everything I have described, the diet, the movement, the stress, the sleep, all of it exists within a broader biological framework. And the number one driver that either compounds all of the others or underpins their effectiveness is metabolic health, specifically the state of your blood sugar regulation and insulin sensitivity. Here is what the research shows, and I want you to hear every word of this. Chronic hyperinsulinemia, which simply means chronically elevated insulin levels in the blood even when they are not yet in a diabetic or pre-diabetic range, is one of the most potent drivers of the inflammatory cascade we have been discussing. Insulin, when chronically elevated, activates a signaling pathway called the IGF-1 axis, insulin-like growth factor 1, which functions essentially as a cellular growth accelerant. In healthy regulated amounts, this is normal biology. But when the IGF-1 axis is chronically stimulated by persistently elevated insulin, it promotes cellular proliferation in a way that directly interacts with cancer initiation pathways. A large meta-analysis published in the Annals of Oncology found that elevated fasting insulin levels were significantly associated with increased risk of colorectal, pancreatic, endometrial, and breast cancer, even in individuals who had not yet been diagnosed with diabetes or prediabetes. The Nurses' Health Study and the Health Professionals' Follow-Up Study, two of the longest-running and most respected prospective cohort studies in American medicine, both found consistent associations between markers of poor metabolic health and elevated cancer risk independent of body weight. That last part matters because I have patients who are normal weight, who eat reasonably well by conventional standards, who exercise occasionally, and who nonetheless have chronically elevated fasting insulin because of the specific carbohydrate composition of their diet, their sedentary evening patterns, their disrupted sleep, or the chronic stress response I described earlier. All of these factors converge in the metabolic system. The IGF-1 axis connects inflammation, immune suppression, DNA damage, and cancer cell proliferation into one unified biological story. And the reason I place this at number one is that it is both the most powerful single lever you can pull and the one that most directly integrates everything else I have talked about today. Improving your dietary pattern reduces insulin load. Consistent movement improves insulin sensitivity at the cellular level through a mechanism involving GLUT4 transporters in muscle tissue. Quality sleep reduces the cortisol-driven insulin resistance that accumulates with sleep deprivation. Managing chronic stress reduces the cortisol-mediated disruption of glucose metabolism. Every single recommendation in this video converges here, in the metabolic environment, in the insulin and IGF-1 axis, in the single most measurable and modifiable biological driver of cancer risk after the age of 60. I want to tell you about Thomas. 69 years old, retired firefighter, physically active by most standard definitions, normal body weight, no diagnosis of diabetes or prediabetes. He came to me for a comprehensive preventive panel, and when we ran a fasting insulin level alongside his standard metabolic panel, his fasting insulin came back at 22 microunits per milliliter. The generally accepted optimal range is below 10. He had never had this test ordered in his life. His fasting glucose was completely normal. His hemoglobin A1C was completely normal. By every standard marker his previous doctors had checked, his metabolic health appeared fine. But his insulin told a different story. It told the story of a body that had been in compensated insulin resistance for years, working overtime to keep blood sugar normalized, but at the cost of chronically elevated insulin and all the inflammatory and IGF-1 mediated consequences that come with it. We made targeted adjustments. We shifted the timing and composition of his evening meals. We added a specific post-meal walking habit of 15 minutes after dinner. We restructured his sleep environment to address the sleep fragmentation that had been silently eroding his insulin sensitivity. And we introduced regular fasting periods of 12 to 14 hours overnight. 6 months later, his fasting insulin was down to 9. That is not just a number on a lab report. That is a fundamentally different internal environment, one that is measurably less hospitable to the processes that lead to cancer. I want to close by giving you something concrete, something you can begin tonight, because understanding the biology is only half of what I am here for. The other half is making sure you leave this video with a real and specific plan. Here's what I call the protective evening protocol. It is not complicated, but it is deliberate, and the deliberateness is what makes the difference. Finish your last meal of the day no later than 7 in the evening. This begins your overnight fasting window and allows insulin levels to fall and stabilize during the hours your body needs them lowest. After dinner, walk for 15 minutes. Not a power walk, not a gym session. A 15-minute walk. This single habit activates muscle glucose uptake through those GLUT4 transporters I mentioned and produces a measurable reduction in the post-meal insulin spike. By 9:30 in the evening, eliminate screens. The blue light wavelength emitted by phones, tablets, and televisions suppresses melatonin production and delays sleep onset, which in turn disrupts deep sleep architecture and the DNA repair processes that depend on it. Use that final hour before sleep for something that does not activate your stress response. Reading, stretching, a warm shower, which has been shown in research published in the journal Sleep Medicine Reviews to accelerate sleep onset by triggering the thermoregulatory cooling response. Be in bed by 10:30 with the goal of 7 hours minimum. Keep your room cool, between 65 and 68 degrees Fahrenheit. That temperature range is associated in sleep research with deeper and more restorative sleep stages. This is your nightly intervention in the inflammatory cascade. This is you, every evening, actively reducing the biological conditions that make cancer possible after 60. I have sat across from patients in their 60s and 70s who came in believing that their family history had already written their story. That cancer was something that happened to them, or it did not, and there was not much agency in that equation. And every single time, walking them through this research changed something in the room. Not because it offered false certainty. Medicine never offers false certainty. But because the data is clear, and it is consistent, and it points in one direction. The choices you make about food, about movement, about how you manage stress, about how you protect your sleep, and about whether you have ever asked your doctor to check your fasting insulin, these are not small decisions. They are the decisions that determine the internal environment your body operates in for the next decade. Your genes load the gun. Your environment pulls the trigger. And the internal environment I have described today, the inflammatory state, the insulin axis, the immune surveillance capacity, all of it is within your reach to influence. That is not a motivational statement. That is what the research says. Dorothy, the woman I told you about at the beginning, she asked me how something like this could happen without warning. The honest answer is that it rarely happens without biological signal. The signals are just ones we have not historically been trained to look for or act on early enough. You now know what they are. You now know what drives them, and you now know what to do about it. That is the difference between this conversation and the one that does not happen until after a diagnosis. Please share this video with someone you care about who is over 60. Not because I am asking for views, but because the person you are thinking of right now, the one who just came to mind, they deserve to have this information before they ever need it.